morning friends, welcome back to my YouTube channel Medical Classes by Srinidhi Acharya. Don't forget to subscribe my channel and also give your valuable comments. So today we will have the continued portion of cerebral palsy. In the part 1 we have so far seen about the basic information regarding cerebral palsy. So we will continue the same today. And we have seen that there are mainly 3 types of cerebral palsy. One is spastic type, another one is disconnect type, and another one is atonic type, and another one is mixed type. Now let us discuss with the first type, that is spastic type of cerebral palsy, where there is involvement of the cortex is main. This leads to spastic type of cerebral palsy when there is involvement of the cortex. Cortex contains so many motor centers. Spasticity of adductor group of the muscles will be also there. Spastic means all the body muscles are undergoing spasticity. It may be hand muscles, it may be lower limb muscles, it may be trunk muscles, okay, even it may be gluteal muscles, even it may be the anal and rectal area muscles. Every muscle undergoes spasticity, and there will be a lot of symptoms related to that. Now when there is a spasticity of the adductor group of the muscles, so usually child will have the seizure grade. Normal side will be overcome by the excited side, that's a knee and thigh are flexed, and adductor group muscles are involved. Spasticity of the calf muscles usually leads to toe walking, where there is a spasticity of the Achilles tendon contracted. Okay. Likewise, the spasticity symptom can occur at any part of the body. Usually, a cerebral palsy patient will also have constipation. That constipation is most of the time it is because of the spasticity of the puborectalis muscle. That is also one possibility. So main thing is the cortex is involved. Cortex contains so many motor centers. Okay, so all the motor programs are controlled by the cortex, precentral gyrus and all those things. When there is involvement of these areas, and there will be formation of the spasticity. Now in the spastic type of CP we have got different types. What are they? Number 1 is monoplegic, only one limb is undergoing spasticity. Diplegic, where both the limbs are undergoing. Hemiplegic, one limb and one upper limb and one lower limb is get affected. Paraplegic, both the lower limbs are get affected. Quadriplegic, all the 4 limbs are get affected. Any possibility may be there in case of spastic CP. Now, in the previous class we have seen that the inhibitory neurotransmitter, when it is less in number, or when inhibitory neurotransmitter is not able to pick up, or when inhibitory neurotransmitter is absent, that is the main cause of spasticity. Because when a muscle contracts, it contracts to a certain extent. Afterwards, it has to be inhibited in a normal person. That inhibition will be done by the gamma neurotransmitters. Because gamma neurotransmitters are considered as or known as inhibitory type of neurotransmitters, whereas dopamine, adrenaline and all those things, glutamate, so they are all excitatory neurotransmitters. Glutamate, then adrenaline, dopamine, etc. are responsible for contraction of the muscle, whereas over contraction of the muscle will be controlled by the inhibitory neurotransmitters, and main among them is gamma aminobutyric acid. When this gamma is not working properly due to various causes, okay, when brain itself is damaged, nerve itself damaged, when gamma neurotransmitter containing neurons are more damaged, okay, gamma is not able to work. So any function which is initiated, that will not be going to end. That will be persistent or continuous, and that's the reason why a contracted muscle continues to contract, and that leads to spasticity and later contracture, deformities, etc. Now, just for interest purpose, there are so many food in our diet which we commonly take daily, which contains more in GABA. Okay, this may help to a certain extent in such conditions. GABA and serotonin, these two are considered as stress releasers, and they're also inhibitory neurotransmitters. Okay, so without GABA, the nerve cells excite more and fire too easily. This is what's happening in case of spastic cerebral palsy. There is less GABA, and as a result, nerve cells are more excited and contraction become continuous and persistent, and that leads to spasticity. Even the anxiety also decreases, and this also leads to spastic disorders. Now there are some food which contains the GABA. For example, grains, whatever grains we take, that contains good amount of GABA. Fava bean, that contains a good amount of GABA. Soya bean also contains a very good amount of GABA. Then lentils, then other beans, then walnuts, okay, almonds, sunflower seed, citrus fruits, tomato, spinach, broccoli, and coca. So these are some of the food items which contains good amount of GABA. Okay, so walnut is good for brain. Usually we say, actually it's working like this, increase the GABA neurotransmitter. It's a very good source of GABA transmitter. Okay, even almonds also. Therefore, usually we say after taking almonds, if you take good amount of the almond at night hours, you will have a sound sleep. The reason is very simple. It's a stress releaser and it also produces serotonin, which is natural sleeping pill. Okay, likewise we can correlate everything, and these are some of the food items that we can implicate in a patient of cerebral palsy in terms of Ayurveda. Now, involvement, so this is about the spastic cerebral palsy. Patient may present with the monoplegia, diplegia, paraplegia, quadriplegia, or hemiplegia. That depends. Okay, it depends upon the area of the damage in the cerebral cortex. Now, involvement of the basal ganglia and disconnected type of cerebral palsy. Second type of cerebral palsy is dyskinetic type. In case of disconnected type, what actually happens is there is no much involvement of the cortex area, but there is more involvement of the basal ganglia area. Okay, damage, which is one-time damage, which is happening in case of cerebral palsy because of birth defects and all those things, that is happening in the basal ganglia area. Okay, so basal ganglia is get damaged, and this is a cluster. Basal ganglia, we know that it contains so many important nucleus. Okay, it plays a very important role in the limbic system. It plays a very important role in the modulation of the movements. Okay, dopamine 1, dopamine 2 types of receptors are present there, and basal ganglia is just like our what you say, manas. Okay, so it decides everything actually, what to do, what not to do. Everything is decided by the basal ganglia. So this is a cluster of nucleus and helps for the initiation and control of the movement of the body. All the involuntary movements, even the voluntary movements, are also controlled by basal ganglia. Okay, so actually any movement which is when initiated from the cortex, it takes an opinion from the basal ganglia. Shall I move on, go on with this movement or not? When basal ganglia say yes, then that movement is initiated. Okay, so even in the voluntary movement also, this is possible. So I will give an example. For example, when you see a beautiful lady, suppose, and so we will have a tendency that we will give a flying kiss, okay, to that lady. Just for your understanding purpose, I'm telling. Okay, so that means your sensation goes, sensory cortex is initiated, sensory cortex also sends signals to the motor cortex. Okay, but before giving the flying kiss, you always think that whether I should go for this or not, because people around me may think very odd, or they may laugh at you. So although you have decided to go for a flying kiss, the next moment you will cancel it. So why you cancel it? That means your motor cortex decided to go for a flying kiss, but right in the meantime, cortex also take an opinion from the basal ganglia, and basal ganglia say no, this should not be done, this is very bad. So then you stop the movement in spite of initiation. So that's why I'm telling, each and every movement when it is initiated, it will take opinion from the basal ganglia. So basal ganglia is a very important structure. It needs a separate lecture to explain that. Okay, so anyway, so here when this such an important part, basal ganglia is affected, so then patient may have hypotonia and hypotonia both. Okay, hypotonia because even the muscular movement initiation is also by the basal ganglia, and its control is also by means of basal ganglia, because basal ganglia controls everything. Okay, so here the patient may be having hypertonia and hypotonia both, but in spastic cerebral palsy, patient is only having hypertonia or spasticity. Okay, so we know that cortex fibers, pyramidal tract fibers, so they are very well connected with the basal ganglion. Okay, so now here in this type of cerebral palsy, one is there may be hypotonia or hypertonia, both may be there. Another one is there is involuntary movement will be there. Patient is having some extra movements, involuntary movements will be there, because the whatever movement that you are doing, that will be also controlled by basal ganglia and modulation. If the movement is more, it will make it less, and if the movement is less, it will make it more. So like this, it will modulate the muscular movement, and then it will send out to the muscles. So when basal ganglia itself is damaged, this function is not able to be done correctly, and that leads to involuntary movements. Dopamine 2, dopamine 1, so they're all affected here. Okay, they lead to involuntary movements. Third one is basal ganglia is also a very important area for the hypothalamus and all those things. So hypothalamus, they are related with the understanding, then cognition power, etc. So cognition is also affected. So these are the three important things that you have to understand when a patient is having dyskinetic CP. Patient may have hypotonia or hypertonia, and the child may definitely will be there with abnormal involuntary movements. Like it may be tremors, it may be chorea, it may be athertoid movement, or it may be another excessive movements, okay, exaggerated movements, that will be there because basal ganglia is affected. Third one is cognition is most of the time it gets affected because all the cognition area that is also present in the basal ganglia area. Okay, basal ganglia also play a very important role in the cognition also. So these three things are present in a patient of CP, then you can say that the area of involvement is basal ganglia. Okay, so so therefore this leads to dyskinetic. Kinetic means movement, dis means disturbed. Okay, so dyskinesia means there is a dystonic movement. Either there will be excessive twitching will be there, hypotonia will be there, hypertonia will be there, sometimes random movements will be there, uncontrollable movements like tremors, etc. will be there. Okay, so they are all the hallmark of this particular dyskinetic CP. Very easy to understand. Okay, even there may be sometimes chorea or dance like movements, etc. Now another type of the CP is when predominantly there is involvement of the cerebellum. The cortex is not much involved, and even the basal ganglia is also fortunately not involved, but unfortunately cerebellum, the damage has been done onto the cerebellum area. So when the cerebellum is affected, always ataxia is a main symptom. Ataxia, patient is not able to balance himself. Okay, no. So decrease in the muscle tone will be also there, and the incidence of this ataxic type or hypotonic type, so that's 5 to 10% incidences. Cerebellum is related with the coordinated movements, balance and equilibrium that we know. So all the three are get affected. When there is involvement of the cerebellum, these all three are get affected. So first of all, what happens? Gait become ataxic. So cerebral palsy patient with the ataxic gait. Okay, so he is not able to balance. He is able to not walk. He is not able to walk in a straight line. So ataxic gait. He cannot walk in a straight line. Okay, so all the cerebellar function tests are positive here, starting from the Romberg's test and so many other tests, which the cold and hot water test, then nystagmus, then Dolce phenomenon. Different tests are there to see all those things. So all are positive here. There will be tremor while doing the activities. Okay, so the tremor of the basal ganglia is different, and tremor which is present in the ataxia type after involvement of the cerebellum is different. So here tremor will be there in doing the activities, maybe intention tremors. Especially child will have more problems while shoe wearing, then buttoning, etc. Okay, so coordination between the muscle movement and the balance has been gone. Now the problems with the coordination, especially with the arms, legs and trunk. Usually when cerebellum is affected, the most commonly affected area is arms, legs and trunk rather than the other parts of the body. So they are more commonly affected because spinocerebellar, anterior spinocerebellar tract, posterior spinocerebellar tract. So these bring the information from the lower limb and upper limb to the cerebellum to maintain the balance. Okay, so when this cerebellum is affected, naturally this tract, the signals received from the tract is also get impaired, and that leads to this particular balance. Therefore seizure gait, etc. is quite common. Okay, of course there is a decrease in the muscle tone because these two tracts, what I told, anterior spinocerebellar and posterior spinocerebellar, they bring the message from the muscles, tendons, joints, etc. to adjust according to the situation. When these tracts are not properly listened by the cerebellum because of damage in the cerebellum, yes, there may be loss of the muscle tone also. Yes, intentional tremor, that will be there. Most common on doing the routine activities, intentional tremor is there. So these are the symptoms that we can say that this is a type of CP, is the ataxic type of CP where there is involvement of cerebellum. Okay. Now, when I say cerebellum, it is very less unlikely that none of the other brains are get affected. Okay, cerebellum is affected dominantly, and other parts of the brain is also get affected. So to some extent basal ganglia may be also affected, to some extent cortex may be also affected. So when we have got such a symptoms where all the three are get affected, okay, all the three are affected, then we will call it as mixed CP. Okay, it's a mixed type of CP. In the mixed type of the CP also, we have to see which dominant areas get affected. Okay, patient is also having some mental problem, patient is also having some spasticity, patient is also having some ataxia. This is also possible. This type is called as mixed type CP. In the mixed CP now you see which part is more affected. Okay, that's number one. Number two, sometimes it may be if the child is very fortunate, it's only one part is get affected. Maybe cerebellum is affected, maybe only cortex is affected, only basal ganglia is affected. Okay, out of this, if the basal ganglia is affected, then the problem is worst, because it's very difficult to manage such conditions. Basal ganglia is affected because there will be mental retardation. Okay, so we find so many cases cerebral palsy. Only problem is with the spasticity, otherwise mentally he is okay. So that is actually spastic cerebral palsy. Or sometimes patient mental retardation is also not there, cognition is very well, he is able to, there is no spasticity also, but he is having problem in walking, not able to maintain the balance. That's ataxia type of CP. It depends. Okay, so now there is one more classification of the CP. Okay, that depends upon the severity of the CP. Cerebral palsy is classified as for the involvement of the site in the brain and also as for the severity. As for the site in the brain, we have seen it may be spastic, it may be dyskinetic, or it may be ataxic. Now, as for the severity, it ranges from mild to very severe cases. Okay, as for severity, it ranges from mild to very severity cases. Now, how to understand the severity of cerebral palsy? The severity of the cerebral palsy is understood by a very important system that is called as gross motor functioning classification system. This is also called as GMFCS. Okay, so there is not even gross motor. We have got gross motor domain, isn't it? Fine motor domain, gross motor domain, etc. So gross motor functioning classification system, that is helpful to understand the severity, and it helps to classify the CP according to severity. According to location, we have already classified. Now, this GMFCS will going to focus on certain things. What is that? Number one is ability to sit, whether child is ability to. We are all seeing the gross motor. We are only seeing the gross motor. Okay, ability to sit, that we will see. Then capacity or capability to do the movement and mobility. Okay, then charting the independence, how much work or how much activities is able to do with independence, and then use of adaptive technology. Okay, use of adaptive technology. Based on these four categories, so we will actually divide the CP as for GMFCS. Okay, now apart from that, on dividing the understanding the severity, apart from GMFCS, we have got other systems also, like manual ability classification system, or communication function classification system, and eating and drinking ability classification system. So totally these four, GMFCS and these three, so they are considered as different methods of dividing the CP into according to severity. So mixed type I explained, when all the four are present, all the three are present together, then it is called as mixed type. In the mixed type also you have to try to find out which is most dominantly involved by looking at the symptoms. Now let us see the GMFCS, which is most commonly used method to understand the severity of the cerebral palsy. So here there are many levels are there. Okay, so level 1, level 2, level 3, level 4, level 5. So we divide the severity of cerebral palsy into level 1, 2, 3, 4 and 5. Okay, what is level 1? Level 1 means the child is able to walk without any limitation. He is able to walk normally. Okay, very good. Level 2 is, that means he is less severe. Level 2, he walk without limitation but can't run or jump. Run rather, it's a spelling mistake. Can't run or jump. Okay, then they need assistive devices, or when they learn to walk, they need a wheelchair to get around outside their home. This is considered as level 2. Gross motor function is a little more disturbed here. Level 3 is he sit with little support and stand without any support, and they need handheld assistive devices like walker or cane while walking in the indoor, or he need a wheelchair to get around outside their home. This is level 3. Level 4 is walk with the use of assistive devices, then able to move independently in a wheelchair, then need some support while sitting. Level 5 is need support to maintain the head and neck position also. Okay, and they need support to sit and stand. They can be able to control a motorized wheelchair. So this is how actually we divide the severity of cerebral palsy, and we will classify it to level 1, level 2, level 3, level 4 and level 5. Now especially when a patient comes to Ayurveda, it's very important to see which level patient is coming. Okay, so it's very difficult to undergo treatment for a level 5 patients. Okay, so before claiming about the cerebral palsy success, and we should be very careful. Level 1, level 2, level 3, yes, we can provide a very good care. When we come to the level 4 and level 5, we have to be little difficulties in treatment. Okay, now in general, if you see the symptoms of cerebral palsy, it's a wide range of symptoms will be there. It depends upon the area of the involvement, etc. Okay, so symptoms varies from person to person and range from mild to severe, and some may having difficulty in walking and other will have trouble in grasping the object. That means some will have more problems in gross motor functions and some will have more problems in the fine motor problem. And sometimes these two problems may not be there, but there may be mental retardation. So like this, the symptoms will range a lot. But anyhow, the common signs to understand: delay in reaching the motor skill milestones, especially gross motor milestone, because spastic CP is most common. More than 90% is spastic CP out of all cerebral palsy patients. Okay, so that is more common. Cortex involvement is more common. So there may be variation in the muscle tone. Muscle may be too stiff or floppy sometime if it is ataxic. Delayed speech development and difficulty in speaking will be also there. Then there will be spasticity. Yes, that is definitely there. Then exaggerated reflexes will be there because it's an upper motor neuron lesion basically. Therefore, there will be exaggerated reflexes, hypertonia, spasticity, etc. And group of the muscles are also involved. Tremors or involuntary movements will be also there. Tremors or the involuntary movements will be also there. Then there will be excessive drooling and problems with the swallowing. There is also difficulty in walking. We know that. These are the general symptoms. Okay, just I am listing out, that's all. Favoring one side of the body. That means one side movement is normal, hemiplegic. Okay, neurological problems like seizures and intellectual disabilities and blindness may also occur, because blindness is also one of the most common cause. Because asphyxia most commonly causes hypoglycemia also. So that affects the retina and occipital center very much. Okay, so if the patient is having even the eye problem also, we can even identify the pathology also. Pathology is a hypoglycemia, which has happened because of birth asphyxia. Okay, anyway, come to the diagnostic parts. The history and physical examination is very important. Okay, the general movement assessment. Okay, measuring the movement that occurs spontaneously before the 4 months of age, that has to be identified. Then you have to see about the abnormal muscle tone, posture, delayed motor development, etc. Then persistence of the primitive reflexes. This is very important for the diagnostic purpose. Persistence of primitive reflexes. Okay, so presence of the primitive reflexes suggests that cortex is not well developed. Still the function is going on from the subcortical level itself. Okay, so therefore it's a big clue. Why the cortex is not developed? Because damage has been taken place. Okay, so early diagnosis and intervention is key in the managing. Okay, even in every case of cerebral palsy, the very important thing is earlier the patient come, more will be the chance. Okay, because whatever we have to do that before the completion of the brain growth, that we have to do. We know that by 5 years the brain growth completely stops, and we have got maximum chance of interfering and modulating the brain function in the first 5 years. Anyway, this is a developmental disability. For the diagnosis, again, the medical history is taken. It should be complete. Then physical examination, detailed examination of the nervous system, and also evaluating the symptoms. Yes, these are part and parcel of the diagnosis. Then electroencephalogram. Okay, to assess the EEG, that is to assess the electrical activity in the brain. This can be done even in the patient with the seizures confusing with the epilepsy. Now, as I told, GABA is not working properly, and as a result the excitatory neurotransmitters are more, okay, compared, because GABA is not working, so they have got upper hand and they will work more or excite more, so that may lead to some abnormal electrical activities also. Okay, so this may sometimes lead to seizure like conditions also, so this may confuse with epilepsy and all. So an EEG is good, okay, for the identification. Then MRI is a we can say gold standard diagnostic methods, powerful magnet and the radio waves to produce the detailed images of the brain. The MRI is used. It identifies any abnormality in the brain. We know that. Abnormal neuroimaging study indicates, suppose MRI is abnormal, then chance of associated conditions like epilepsy, intellectual ability, disability are also more. CT scan, okay, brain damage will be revealed by the CT scan, okay. Then another is cranial ultrasound. Cranial ultrasound is a quick and inexpensive method of using high frequency sound and to get the basic image of the brain. This is inexpensive and also quick method. Okay, yes, blood sample can be taken if the cause is because of infections and bleeding tendency and some other intracranial infections, etc. The blood sample will going to help us. Now, when we see the diagnosis, what are the most common differential diagnosis for cerebral palsy? Okay, even hydrocephalus may also cause similar symptoms. Okay, developing hydrocephalus. Then prosencephaly will have the similar problem. Arteriovenous malformation may be the cause. Subdural hematomas, then hygroma, etc. Apart from this, there is a big list of differential diagnoses actually, because CP is always because of the static cause, okay, one-time injury, and it's a non-progressive disease. If any this developmental delay, spasticity or hypotonicity, whatever may be, if it is progressive, that itself actually, or regression of the developmental milestones, that itself exclude the cerebral palsy. Cerebral palsy is one-time injury. Injury is permanent. There is no further improvement, progression in the injury or development of the symptoms. What are the symptoms produced? They will be there. That's all. Because of one-time injury. That's one of the best way to differentiate cerebral palsy from the other disorders. Many times clinically we will have a confusion, and we will then at the end we end with the diagnosis of everything as cerebral palsy. It's not like that. Cerebral palsy cannot be progressive. Cerebral palsy, so there are so many inborn errors of metabolism, there are so many congenital problems, so many genetic problems, torch infections causing their effect in the later part. Then other neurodevelopmental problems, behavioral problems, okay, cognition problems, which looks like cerebral palsy, but they are not cerebral palsy. That in the next class we will see all those details. Okay. Now, age of diagnosis, age at which actually you diagnose cerebral palsy is also very important. Actually, cerebral palsy is a vague term actually. Okay, so therefore, age at which you diagnose a cerebral palsy is also very important. Earlier, the diagnosis, better is the chance of physical and educational help that we can offer to the child. Earlier the diagnosis, greater the chance of confusing with the other conditions also. That's one more important thing. When you diagnose CP at the early part, then you have got a greater chance of confusing with the other conditions. That's what I listed. Okay, so even sometimes autism patients also look like that. Sometimes intellectual disability patient also looks like that. Okay, or even sometimes hypothyroidism, cretinism patient also looks like that. Many things are there. So the correct age of diagnosis to say that, declare that this child has got CP, that is now considered as 18 month. It should not be done before 18 month. Okay, with 18 month, almost all 2 years. That means by that age the maximum growth of the brain will be complete, and major developmental milestones are also get completed, especially related to the gross motor and fine motor. So it is considered as a right age. Okay, 18 months. So infants may have temporary muscle tone problems or problem in the control of the muscle tone. So that may get confused. Okay, so many metabolic. This is what I told. So many metabolic disorders, tumors, space occupying lesions. Okay, they also look like CP. Hydrocephalus looks like CP. The only thing is CP is not progressive and there is no regression of the milestones. It's a one-time injury. Okay, and that's the key point. So some of the metabolic problems, especially in CT, also give some finding like the CP. Inborn errors of metabolism or acquired errors of metabolism may lead to similar presentation of cerebral palsy. So be careful. Then disorders of the white matter of the brain can also cause the problems like spasm, pain, and weakness, etc. Adrenoleukodystrophy. This is one of the actually white matter problem. We will have what is white matter, gray matter, that we will see when we discuss the Ayurvedic discussion of treatment. Okay, treatment through Ayurveda. So not able to sit independently by the age of 8 months, suppose, is one of the important clinical signs which further monitoring is required. This is one of the important clue. And persistence of some of the primitive reflexes. They are also very important clues. So we need to rule out the Fragile X syndrome, and general intellectual disability must be ruled out. There are so many syndromes like Fragile X syndrome may also have mental retardation. Okay, so this is very difficult. So diagnosis of CP should be done very carefully. Therefore, the right age, watch the baby up to 18 months and then you diagnose this as CP. Before that, it is indicated that you should not diagnose a case as CP. Mention the case as CP. Okay, because all the other disorders may have the similar symptoms which confuse us with the CP. Other evaluations, vision loss impairment is very important, because I told hypoglycemia, if there, then vision loss will be there. Deafness, yes, then speech delay, then intellectual disabilities and movement disorders. These are the other evaluations that you have to do. Now, some of the common conditions which are associated with the CP are communication difficulties like speech and language. Okay, so child is able to understand, not able to speak, or child is not at all understanding and not speaking. So variety of communication problems are there. Another important problem is spinal deformity such as scoliosis, kyphosis and curvatures. This also cause big problem to the child. Okay, kyphosis, humpback, lordosis, saddleback. Sometimes there may be osteoarthritis, contractures, incontinence, osteopenia, then dental problems will be there. Now, how to treat cerebral palsy? Okay, so for the treatment of the cerebral palsy, we have got assistive aids. Okay, so patient can be treated with the assistance. Certain assistance can be given to the child. Assistance aids can be given. Like for the eye problem, we can give the eyeglasses, hearing aids, walking aids, body braces, and wheelchair, etc. Certain medications can be also given, like oral anticonvulsant and muscle relaxants. Botulinum toxin type A injection can be given to reduce the spasticity. Diazepham, dantrolene, baclofen, etc. medicines can be also given in the contemporary science. The surgeries which are indicated are orthopedic surgeries that relieve the pain and improve the motility. Then to release the tight muscles, correct the bone abnormality, and the elective dorsal rhizotomy can be also done to release the spasticity of the muscles. And we have got some multidisciplinary treatment now. We know that in case of cerebral palsy, always we have to go for multidisciplinary treatment. Okay, so speech therapy, physical therapy, occupational therapy, recreational therapy, then counseling or the psychotherapy and social services consultation and stem cell therapy. Okay, so that is also indicated. Always when we tackle a patient of CP, you have to always keep in mind that always go with the multidisciplinary treatment. It is a disease which requires multidisciplinary treatment. Only one physician cannot do anything. So how to prevent? If the pregnant or if a mother is, that is lady is pregnant or planning for the pregnancy, then get vaccinated against the disorders which can cause the brain damage like rubella. Okay, then receive adequate prenatal care. Then prevent the premature birth by all means. Then electronic fetal monitoring should be done. And those with the risk of early delivery, magnesium sulfate can be given to decrease the risk of CP. These are all the explanations given in the contemporary science. Okay, postpone the delivery if possible, because preterm delivery is more dangerous. Then caffeine is used to treat the apnea of the prematurity to reduce the risk of preterm babies. Now come to the last part, that is Ayurvedic understanding, how we can understand. So this portion we will have a detailed discussion in the next class. Anyhow, this particular cerebral palsy in Ayurveda can be considered as Samvardhana Vikara. To some extent, it is also matches with the explanation given under the Vakaroga. To some extent, it can be taken as Shiro Marmhabhigata. It's also a type of injury. Okay, it's ischemic injury which is taking place. Then Dhatuk Kshayajanna Vata Vyadhis may be also there because of brain atrophy and all. Then Pranavrtavana or other Avrtavatas can be also compared. Anyway, we will have a detailed discussion later. What actually we are aiming in Ayurveda actually, to increase the quality of the life, to decrease the muscle spasticity, to enhance the communication skill, to enhance the cognition, to enhance the fine motor activities, and also to increase the language function. This is our aim. What are the limitations in the treatment? Age of the child is a big limitation. More age of the child itself is a big hindering factor. Then if the comorbidities are more, that is also a big problem. Mental retardation is always a limitation because very difficult to tackle a CP child with a mental retardation. Dependency, then level and extent of involvement, and also chronicity. And these are some of the basic ideas regarding the cerebral palsy. And in the last two classes, part 1 and part 2, this is part 2, we have seen the basic information regarding the cerebral palsy. In the next class, we will see the Ayurvedic understanding and also treatment of spastic cerebral palsy according to Ayurveda. Thank you very much. We will meet again. Again, don't forget to subscribe my channel. Thank you very much.